Good morning, everyone. Give me some energy in the room. We should be caffeinated. Good morning, everyone. Just a note here, my colleague Aisha has been promoted to Executive Director of Westside United in the last month or so. Just a little bit about Rush before I dive into the slides. So Rush is a 180-year-old academic medical center located in Chicago on the west side. It's actually a couple of days older than the city of Chicago. We have about 10,000 employees, and we are the largest private employer on the west side. We don't have a $9 billion sheet, but it's about $2 billion, so there are resources that are there. In 2016, a couple of things happened. One, Rush changed its mission from to be the best in healthcare to improve the health of the individuals and the diverse communities we serve. And that meant that instead of just looking at how we handle the quality of care for patients that come within our four walls, we started to look outside of our neighborhoods and really evaluate what we were doing with community programs, community partnerships, and community interventions. As a part of that, it's one thing to change your mission, but if you don't develop a strategy around it, then it's just words on a page. And so developing deeper community partnerships and taking a look at our work became part of a 4-part strategic priority within Rush. At the same time, we were doing our community health needs assessment. Again, this is all in 2016. And what we learned is despite the fact that Rush is literally located in the Illinois Medical District with lots of safety net institutions, federally qualified health centers, and others, we still had significant gaps in life expectancy outcomes. So in 2016, these were the gaps that existed. If I'm fortunate enough to live in the downtown area of Chicago, life expectancy is 85. If I go just a couple of stops on the blue line from where Aisha and I generally sit, it goes down to 69 in West Garfield Park. This became a rallying cry. You can't look at that slide and just bypass it. It calls out to do something about it. So what are we going to do? The first thing that we came up with, and it's a part of, someone mentioned earlier, the Democracy Collaborative. The reality is we have a lot of resources at Rush. So how do you take those resources as an anchor institution and intentionally and strategically invest them on the west side? And so that meant, who are we hiring when people are coming through the door at Rush? When they come through the door at Rush, what career paths are available to them so that folks don't come in an EVS or environmental services role and stay there for 30 years and not be able to progress in their careers? We build a lot of stuff at Rush. When we're putting buildings together and building things, who's on those job sites? Who are we hiring to do that work? We also are like a large cruise ship. We buy a lot of stuff, have a significant supply chain. Who are we partnering with? What vendors are we working with? Who has our contracts? Also, we're fortunate enough to have a little bit of margin when it comes to our operations. How can we use some of those funds to invest locally on the west side in community economic development projects? And lastly, let's put those 10,000 employees to work. How can we catalyze them to volunteer in our surrounding west side neighborhoods? So this was one of the first things that Rush determined or decided to do, again, just in 2016, is to own that anchor mission status. But even with that, we recognize that we can't do that work by ourselves. If we're in the Illinois Medical District, what are other health institutions, safety nets, federally qualified health centers, what are they doing? And so we developed what's called the West Side Anchor Committee so that we're all working in each of these 5 areas that are identified on this slide. The partners that are around the table in that work combined have about 44,000 employees. If our folks on our anchor committee were one entity, we would be the largest employer in the state of Illinois. We have $5 or $6 billion in supply chain among all of those institutions. And so the goal of that anchor mission work is, yes, Rush is a catalyst for it, but let's bring other people into the party to also share their resources. To do this work, it does take investment. I can't do all that by myself. I'm fabulous, but I just can't move the needle all by myself. And so one of the things that Rush has done is invest in an internal structure to help lift this work up. And so on this slide, we've got people that have been hired in the last 2 years to help us move our anchor mission work forward. And we do have buy-in from our executive leadership. Our C-suite is all in this, sleeves rolled up. They know what's happening, and they are committed and invested in this work. And they've put their money where their mouth is by having full-time FTE dedicated staff to help us move the needle in this work. The last thing that I will mention is you can have an anchor mission, you can have your friends come to the party with the West Side Anchor Committee, but we also recognize that it's got to be bigger than that. Like, where's the community in it? Where are community-based organizations, social service agencies? Where's philanthropy? Where's government? And that's when Rush became the catalyst to start what is called West Side United. And now I'm going to turn it over to my colleague, Aisha, to talk about that work.